Welcome to Ulosca channel. Access all WGU practice questions. History of Healthcare in America practice questions with answers.
Question 1. Which act established Medicare and Medicaid in the United States? A. Affordable Care Act. B. Social Security Amendments of 1965. C. Hill-Burton Act. D. Health Maintenance Organization Act. Which one is the correct answer? The correct answer is B. Social Security Amendments of 1965. Explanation. The Social Security Amendments of 1965 created Medicare for individuals aged 65 plus and Medicaid for low-income populations, greatly expanding access to health care. Question 2. What was the primary goal of the Hill-Burton Act of 1946? A. Provide insurance to all Americans. B. Fund the construction of hospitals and improve access to care. C. Create the Centers for Medicare and Medicaid Services. D. Reduce the cost of prescription drugs. Which one is the correct answer? The correct answer is B. Fund the construction of hospitals and improve access to care. Explanation. The Hill-Burton Act provided federal grants and loans to build and modernize hospitals, especially in underserved rural areas, improving nationwide access to medical care. Question 3. Which organization was created in 1946 to conduct medical research in the U.S.? A. World Health Organization. B. Centers for Disease Control and Prevention. C. National Institutes of Health. D. American Medical Association. Which one is the correct answer? The correct answer is C. National Institutes of Health. Explanation. The NIH became the primary U.S. agency for conducting and funding biomedical and public health research, advancing medical science and innovation. Question 4. Which U.S. law, passed in 2010, expanded health insurance coverage and introduced health insurance marketplaces? A. Medicare Modernization Act. B. Affordable Care Act. C. Health Insurance Portability and Accountability Act. D. Social Security Act. Which one is the correct answer? The correct answer is B. Affordable Care Act. Explanation. The Affordable Care Act expanded coverage through Medicaid expansion, created health insurance exchanges, and prohibited denial based on pre-existing conditions. Question 5. The Flexner Report of 1910 had which major impact on U.S. medical education? A. Increased the number of medical schools. B. Standardized and improved the quality of medical training. C. Reduced licensing requirements for physicians. D. Ended government funding for medical education. Which one is the correct answer? The correct answer is B. Standardized and improved the quality of medical training. Explanation. The Flexner Report recommended higher admission standards, better curriculum, and more clinical training, leading to closure of substandard medical schools. Question 6. Which federal program provides health insurance to low-income individuals and families? A. Medicare. B. Medicaid. C. TRICARE. D. CHIP. Which one is the correct answer? The correct answer is B. Medicaid. Explanation. Medicaid is a joint federal and state program that provides comprehensive coverage for eligible low-income individuals, families, and people with disabilities. Question 3. Which theory suggests that aging is a result of wear and tear on the body over time? A. Activity theory. B. disengagement theory. C. Wear and tear theory. D. Continuity theory. Which one is the correct answer? The correct answer is B. Encourage the development of prepaid, coordinated health plans. Explanation. The HMO Act promoted cost-effective, coordinated care by supporting prepaid health plans where providers work within networks to deliver services. Question 8. Which government agency was created in 1970 to protect public health and the environment? A. CDC. B. NIH. C. FDA. D. EPA. Which one is the correct answer? The correct answer is D. EPA. Explanation. The Environmental Protection Agency enforces environmental laws and regulations, protecting air, water, and land to safeguard human health. Question 9. The Children's Health Insurance Program was created in 1997 to provide insurance for A. All children in the U.S. B. Children and families who earn too much for Medicaid but cannot afford private insurance. C. Children with disabilities only. D. All low-income families. Which one is the correct answer? The correct answer is B. Children and families who earn too much for Medicaid but cannot afford private insurance. Explanation. CHIP offers low-cost coverage for children and working families with incomes too high for Medicaid, but insufficient for private coverage. Question 10. Which historical events significantly increased the demand for organized hospital care in the U.S.? A. Civil War. B. Great Depression. C. World War II. D. Korean War. Which one is the correct answer? The correct answer is C. World War II. Explanation. World War II advanced medical technology and treatment methods, increasing the need for hospital care for wounded soldiers and later civilians.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.